You're in touch with Radio Jamaica 94 FM. It's now 3 o'clock.
And from that, you know what it means. Good afternoon. It's Sunday, January 19. Welcome to the CCRP update for Celebrate and Protect Jamaica Seniors. They offer many benefits. Visit our website at ccrponline.org. CCRP update is brought to you by J&J Silver Shield, the best choice for auto and property insurance exclusively for CCRP members. Contact Gallagher Insurance Brokers or J&GI for best value and a boatload of benefits. In today's update, we welcome our very, very special lady, Ms. Charmaine Robotham, Director of Health Promotion, Public Relations, and NHF. And she'll be reinforcing information already in the public domain, but maybe you haven't been paying attention. So stand by. It's priceless. It's NHF 101 with Charmaine. But first, a little family business. Our CCRP update sponsors, J&GI, offer their amazing Silver Shield plan for auto and property insurance exclusively for CCRP members. The auto plan includes free benefits from the Jamaica Automobile Association with valet service for vehicle registration, fitness, 24-hour road services. CCRP also offers enjoyable excursions as well as socials and other events, and we have over 100 CCRP discount partners. The list of discount partners can be found on our website, ccrponline.org. We are dedicated advocates for the rights of seniors, and we also offer 2 health insurance plans underwritten by Sagicor for our members. On next week's program, we'll speak with a representative, and of course, that will be all about seniors, how to conduct ourselves in a bank, how to get the best out of that experience, because we do our banking and sometimes we love the face-to-face, sometimes it's probably better to do it differently, but that will be on tap for CCRP update next week. So now to the core of today's update. Without health, what do we have? Except a ticking time bomb to expiry. That sounds grim, right? So we're not even going to think that way. Health is the way to think. And thank the National Health Fund. Modern sciences, many health management interventions, things to enhance the quality of our life, to live longer, better quality. And here to guide us a little bit through that, Director of Health Promotion, Public Relations and Customer Care at the National Health Fund, Ms. Charmaine Robotham. Welcome, Madam Top Tier. How you do?
I am very well, thank you, Jerry. And how are you?
All the better for hearing you. Always. We know we're going to get wisdom with Charmaine. So we're always happy to hear from you, and glad that you're able to carve out this time to tell us a little bit more or to reinforce the things we already know. Ready? All right. So now the NHF has been a consistent top performer in the public service. So let's start with a brief overview of the National Health Fund. What makes this organization, its mission, and why it does what it does?
Right. Thanks again, Jerry. And let me take this time to say good afternoon to your listeners and in particular your seniors, since we are in the CCRP feature section. So the National Health Fund, we're a statutory body under the Ministry of Health and Wellness, right? And it was established to reduce the financial burden of healthcare on the Jamaican population. You know, healthcare costs can be very expensive. And we do so in, I would say, 4 major ways. We assist Jamaican residents to access specific medication, medical supplies, and health screening by providing subsidies through the NHF card. The NHF also has responsibility for delivery of inpatient and outpatient pharmacy services for the public health sector. And this includes the management of the medical warehouse and providing full-time and scheduled services at public sector locations island-wide. And we have 106 of these locations island-wide, and the others are scheduled services. And then, of course, we provide funding to institutions to improve healthcare delivery, including health infrastructure, perhaps the building of a new health center, the building of a ward, the upgrade of medical equipment, purchase for transportation, disaster preparedness, training. And of course, we also fund and support health promotion. Mentioned that we were a top performing agency. Well, one of the things that we do at NHF is that we're always focused on the customer. We are a customer-centric organization. So whatever we do, we seek to provide excellent customer service to our customers, whether for the NHF card, whether it is patients in our drug serve pharmacies or regional health authorities, whoever we interface with. We try, and I think that's one of the reasons why the organization has won so many top awards for customer service.
You definitely walk the talk, believe me, and more. I mean, I still remember the time when I realized that I could be in and out half hour, less than that to get my card. I'm like, what? This in Jamaica? You know? And so we can aspire to much more in so many other things when we have our great examples like NHF. Let's talk about the card program. That's the one that most of us interface with very regularly.
It is available to all Jamaican residents of all ages, assisting with the medication costs for 22 chronic illnesses. And there are two other areas, but let us start with the medication costs for the 22 chronic illnesses. So once you have an NHF card and you go to a private pharmacy, you're able to use the card to get subsidies on the medications that are on the NHF card program. So that means that you're going to take less money out of your pocket to pay for your prescription medication. Now, just to say that if you have another health card, the NHF works with your private health insurance card as well. And what really should happen is that the pharmacist would take off the NHF subsidy first, and we aim to have our subsidy at about 50% of the cost of the drug. So once that is subtracted, then your private health insurance card is applied to the balance. So overall, you're going to be taking less out of your pocket, and your private insurance for prescription can last a little longer. I don't know if you want me to go through the 22 conditions.
maybe not all of them,
Yes,
but maybe you could flag some of those that are really very relevant.
Yes, the asthma, we have a lot of children enrolled for asthma, arthritis, and then we have a number of cancers: breast cancer, prostate cancer, lung cancer, multiple myeloma. Those are some of the cancers, colorectal cancer as well, glaucoma, high cholesterol, epilepsy, of course, high blood pressure and diabetes are there as well, because these are very, very common illnesses. Sickle cell disease, thyroid disease, vascular disease, and of course, psychosis. So you can, those are the, some of the conditions that you can get subsidies for to buy your medication. Then, of course, the NHF card also provides subsidies for screening tests. So there are 4 on the program currently. There's a breast cancer receptor studies test. So once, you have been diagnosed with breast cancer, there's another test that can be done to see what type of cancer you have, and that will help with the treatment. So this test is available at the University of the West Indies Health, the hospital laboratory. And then there's the HbA1c test This is for persons who have diabetes. You should do one of these tests every 3 months. And the subsidy on that was recently increased. It's now $636 per test. And last year, 2024, we added the pap smear to the NHF card. So all women living in Jamaica, 21 years to 64 years old, can use the NHF card once every 3 years and to get a subsidy off the reading of the smear. That's $1,300. And then, of course, there's a PSA test for the men, the prostate cancer residents, male residents, 40 to 74 years can get this annual subsidy to do their PSA test, and that's $1,600 discount. And I'm not done yet.
Yes.
If you have the NHF card and you're a diabetic, you also get subsidies of your test strips, lancets, and syringes, those things that you need to use to test your blood sugar or and for asthmatics, there's pumps, pacers, and masks that can be used as well for the more effective delivery of the medication. So beneficiaries enrolled for diabetes also qualify for a complimentary glucometer and insulin pen every 2 years. So you can go on our website and you will see the glucometers that are available on this program.
Yes. I personally know about that one. And it's amazing how you're continuing to extend as
Yes,
as
of
is
course.
possible.
And we have to extend and increase based on the funding that we have available to us. But I just want to add again, Jerry, that you have the card, but different age groups get special attention. So children, for example, if you're below 18, you get double subsidy. So if this application is, say, $100, and this is just for example, the NHF would give you $200 to the child to help pay for the asthma medication. For the elderly, when you get to 60 and you have the NHF card, there are a basket of drugs that are for about 10 conditions. You can also use the NHF card to get the discount available for persons 60 and over. And that's $40 for each month's supply of the medication, up to $280 for 6 or more. So that's another benefit of the card for different age groups.
So that's an update of the previous JADEP, isn't it?
Well, it's still JADEP.
It's still JADEP. Okay.
But it's we used to have two different cards.
Right.
You have to walk up with two different cards. So
exactly
what we have now done is once you have the NHF card and you're 60, you just use the NHF card. There are still about 500 people who still only have the JADEP card. And we're encouraging them to switch over to the NHF card because there are more benefits on the NHF card for them.
Right. Understood. Tell me a little bit now, how can seniors and their extended families stay connected with the NHF, to make sure that we know what is happening? I mean, you do quite an excellent job of getting the information out, but sometimes we can miss it, and we want to be, if we're missing anything.
Yes. So I would say seniors, call us 906-1106 because, some seniors aren't as savvy with the internet and so on. So call us and our customer care officers are there and ready to talk to you. And of course, you can also visit the website. It's a lot of information there. If you have a youngster around, you can ask them to access the website. And of course, we're on social media as well, Facebook, Twitter, and Instagram. So you can certainly hook up with us at NHF Jamaica on these platforms. So call us for any information you need, and we will be very happy to assist you with any information that you require on the NHF and the
Brilliant. Thank you so much, Madam Director. You did a brilliant job as always, and we're excited about the work you do, and thank you so much.
My pleasure. Good afternoon, dear
All right.
listeners.
Thank you, Charlene. Of course, Director of Health Promotion, Public Relations and Customer Care at the National Health Fund, Charmaine Robotham. Until next Sunday at 3 for all things CCRP, visit our website, ccrponline.org. And of course, we have the YouTube channel where we do the replays of this weekly program, so you can catch up if you didn't catch up last week. CCRP Update, brought to you as always by J&GI Silver Shield, the best choice for auto and property insurance, exclusively, tongue-tied. The best choice for auto and property insurance exclusively. Got it right for CCRP members. Contact Gallagher Insurance Brokers or J&GI for best value and a boatload of benefits.